Hey everyone, I'm Dr. Jay Bowen, a board-certified physiatrist and co-founder of New Jersey Regenerative Institute for NJRI. And yes, I'm officially back into the wild world of YouTube. I know what you're thinking, why does this guy look like he just discovered how to use a camera? Or, well, you're not too much wrong about that. Well, he had some amazing staff that recently moved on, and now I'm learning firsthand just how not so easy this video stuff is. Social media makes it look so simple. Crisp edits, fancy graphics. Where do they find all the time? I'm just trying to treat patients. I've come to the conclusion that I either need a production team or just hire my kids. Well, maybe my partner's kids. But if you're not here for my digital growing pains, then you're here for your back pain, your pain. And you're in the right place. So today, I'm diving into the 5 most common spine issues that I see here in my office, plus a couple of bonus ones that I believe deserve some mention or attention. Now, depending on who you ask, some folks are lumpers, like group everything together, and others are splitters, breaking everything down into hundreds of tiny little categories. I'm somewhere in the middle, as it depends on the topic. For this, I've bundled the information into 5 key categories to keep it clear, helpful, and practical. My hope is that as you watch, you might recognize your own symptoms and start to understand what's really going on, because spine pain doesn't have to be a mystery. In this series of videos, I'll take each of these 5 categories and break them down, one by one. We'll go deeper into treatment options and how we approach them here at NJRI, especially the regenerative treatments that we're known for. Well, let's get into it. So, to start with the basics, we'll use this model. And to sum it up, the spine is this long column of bones. There's 33 vertebral bodies. And these vertebrae are divided into the neck or cervical region, the thoracic or mid-back, and the lumbar or low back. Now, we can't forget about this triangular bone at the base called the sacrum, that's part of the whole pelvis, and the tip, the coccyx. The lumbar spine, or your low back, is built to carry a lot of load and gives you mobility. And therefore, that's probably why the reason it's the most injured. Between each of these vertebral bodies, there's a disc. This is like a shock absorber. And then if we rotate around on the back side, we have these little pair of joints called facet joints. It's made up of the top part of the joint and one vertebral body with the lower vertebral body in its joint. And then those move together. That helps movement and load. The back part of the spine carries about 20-30%, while the vertebral bodies carry the remaining 70 or 80%. There are ligaments wrapped all the way around and muscles, and they help stabilize everything as cables, ligaments, and muscles on top of that to help move things. But when something goes wrong, any of these pieces can be a reason for the pain. Now, if you're watching this video, chances are you've dealt with low back pain at some point, because you're not alone. In fact, 85% of people will have at least one significant episode in their lifetime. And it's also the leading cause of disability. Now, there's something that's ironic. The good news is that most of these episodes go away in 6 weeks. And the bad news is most of these episodes resolve in 6 weeks. Why is it bad news? Well, because it clears up on its own. People think, well, I dodged a bullet and I'm fine. But there's never really the deal with what happens in the first place. This first is a signal for your body that says, I should listen. And they say an ounce of prevention is worth a pound of cure. Most spine pain I see doesn't come from one big injury. It's really just tissue overload over time. And that basically means your spine is being asked to do too much or hold positions that it was just not designed for. The spine does not have any big fat blood vessels supplying oxygen and nutrients to it, at least in the discs. The back stays healthy with proper loading and motion, so that nutrition can get in, but waste products are pushed out. Think of bad posture, slouching your desk for hours, or standing still all day. Over time, this creates strain on the ligaments, and they can get stretched, fatigued, and can even develop micro tears. These same basic bad positions puts increased pressure on the discs, which is between the vertebral bodies we looked at earlier. And that can lead to small tears, such as disc bulges or eventually even herniation. Now, here's where your muscles step in. They try to help stabilize the area and offload forces. But muscles aren't really built to hold a static load all day long. Muscles are like switches. They like to turn on and turn off to maintain posture as you move and sway. But when they're stuck in the on position and they're always contracting, they get overworked. And then they spasm because they're pissed off. And boom, secondary, additional, and more pain happens. Now that we have a little overview and context, in the next few videos, I'll cover the 5 most common spine problems I see in my clinic and what to do about them, including both traditional and regenerative treatment options. The 5 most common problems will be sprains and strains, which are overloaded ligaments and muscles, which might sound simple, but if they're ignored, they can become chronic. Also, they can be very painful. Most people just sort of minimize them, especially medical providers. So we'll talk about the best way to treat them without slowing your healing. Number 2 are pinched nerves or radiculopathies. This is where a disc herniation presses on a nerve and you get shooting pain down your leg. We'll explain when to worry and how most people can recover without surgery. Degeneration of the low back or lumbar spondylosis. This is wear and tear arthritis of the spine. But degeneration isn't just age-related, and we'll talk about why it hurts and how to treat it in the long term. Number 4, sacroiliac joint dysfunction or SI joint. This can often be misdiagnosed. The SI joint pain is literally a pain in the butt. We'll cover how to find it, what it really works from stabilization to regenerative therapies. Number 5, scoliosis or sort of a crooked spine. It's not just for teenagers. Adult scoliosis is more common than people realize, especially if degeneration pulls the spine out of alignment. And we'll explain what to do. Each video will go deeper into these 5 common issues, and there's some bonus conditions like spondylolysis and compression fractures. No one should have to live in pain because they didn't get the right diagnosis or the right treatment plan. So whatever your pain is, from a sprain, a disc, a joint, or something different, these videos will help you figure it out. I'm Dr. Jay Bone from New Jersey Regenerative Institute, and this is your guide to taking back your spine